My name's Fran Loftus. I'm a senior clinical pharmacist and I work across 5 GP practices in South Gloucestershire. I'd worked in hospital pharmacy for around 10 years. I was looking for a new challenge. General practice pharmacy was a new role for pharmacists at the time I applied for that job. I wanted a more clinical patient-facing role and an opportunity to use my prescribing qualification. As a senior clinical pharmacist, I have a mixture of clinical work and work supporting the other pharmacists in the practices. So I will do a mixture of clinics, hypertension, medication reviews, where I'm seeing patients, and I spend time with the pharmacists supporting them in the development of their role and any projects they're involved in. As I work across 5 different practices, I work with a lot of different teams. They're all slightly different. I work closely with partner GPs at every practice. As well as that, I work with nurses, physiotherapists, and the prescription clerks I work closely with. I've been involved in training them across all the practices. As part of the NHS England pilot scheme for pharmacists in GP practices, we've had access to an 18-month postgraduate training programme with the Centre for Postgraduate Pharmacy Education. This has involved study days, local learning sets and a variety of assessments to give us the skills we need to work in general practice. I think because these roles are new, GP practices are looking for people who can bring innovative, creative ideas for how to develop the role, take a proactive approach. It's not necessarily about having loads of extensive clinical skills. These can be learnt on the job. It's more about having good ideas for how a pharmacist can fit into the team. The most rewarding thing about my role is having the opportunity to have follow-up with patients and see them on an ongoing basis and the difference that I get to make to their lives through the care that I provide. Well, I've been fortunate enough to be involved recently in a feedback survey with patients, and the feedback about having pharmacists in practice has been universally positive. They all are pleased to have the opportunity to discuss their medications at greater length than they sometimes get with a GP, and the high level of access, being able to get appointments quickly with the pharmacist to discuss it. It's a really exciting new opportunity for pharmacists to develop new roles with clinical skills, an opportunity to use prescribing, as well as working in a multidisciplinary team with doctors, nurses and others. Working in South Gloucestershire, you've got all the benefits of living in Bristol on your doorstep. Great places to go out and eat and socialise, lots to see and do. As well as that, working in South Gloucestershire, we've got a great local professional network working in the medical field and good hospitals locally as well. I recently had an appointment with a patient who was an ex-nurse himself. I was seeing him to monitor his blood pressure and check the medication that he was on for his blood pressure. After our appointment, he wrote a brief note to the practice just saying how great he thought it was that we had pharmacists in practice now and what a difference it had made to him to be able to spend the time discussing his medication with me.